progress in Wuhan. To translate General Secretary Xi Jinping's idea into reality, the CPC Governmental Committee has normalized the prevention and control of COVID-19 in the day-to-day life of Hubei Province. That is how we are going to stabilize the progress in Hubei. Previously, we have adopted measures in the 7 fronts. First, we have emphasized the prevention and control in the community level. We have transferred our daily control into the prevention manner, and we have built a regular team working in the community to help us to build up the network to find out potential risks for the COVID-19. And we have also built up the virus-free communities. And in these communities, we are collecting information of the outbreak of COVID-19, and we have also working on the outbreak might occur in the school campus. We have listed all the teachers and school staffs into the potential testees for the NAT testing. For the schools resume their day-to-day activities, there is no single one case. Secondly, we are also working on the disease prevention control in the public area. We have limited the openings of the entertainment places, including the places for playing cards, among other different entertainment areas, because they don't have a very good ventilation condition. For other different public places, after doing a very good sterilization effort, we are going to open them in a timely manner. And gradually, we are going to see the day-to-day life's operation turned into normal. And we are also working on the overlapping of different potential infectious resources. Fourthly, we have also do a good job in the follow-up effort of the discharged patient from the hospital. By today, all of the medical institutions and community hospitals have built up the ICAPs for over 60,000 patients discharged from the hospital. And we have also working on the fever clinics and also fever prevention and control. We have also made several different measures in terms of the fever prevention and fever control. And we have also built a very good alarming system in the hospital. And that is our first and forefront line working at the hospital. We have also make up 2 closed loop for the confirmed cases and also the possible suspected cases. Fifthly, we are also working on the asymptomatic patient, and we have also enlarged the coverage of the NAT testing for those people who departed Wuhan, medical workers, teachers, among other different categories of the working staffs. We actually test all of them, and for all of the other people who can get, everybody can get a test when they applied. By the 17th May 2020, the total tested result is actually covered over 300,000 people in the city of Wuhan and across the province. For those who have who have a positive result, we have also conducted the serological testings, CT testings, and we have also working hard in promoting the work resumptions. By the 13th of May, the total resumption of work is reaching 79%. For 5,400 different construction sites, 99.3% of it is resuming their day-to-day operation. That is to say, we have clearly won the battle of COVID-19 in Hubei and in Wuhan. We must cherish this result. And we must adjust our policies according to the time and the situation. By the 7th of May 2020, the National Joint Prevention Control Mechanism has published the guidelines for the normalizations of COVID-19 prevention and control. Echoing that guideline, in Hubei Province, we have also come up with a plan for the control and prevention of the mild and asymptomatic cases in Hubei. And we have came up with a very easy handbook in our day-to-day operations. And this handbook is working at 6 different fronts. The first one is that we should optimize the prevention and control. And we are working in a timely manner, and we are trying to put forward a hygiene campaign. And under the professional guidance of the medical experts, the whole population is working towards the day-to-day health. And secondly, we are also working on the community front line by building up a party-led, commonly shared mechanism. According to the situations of the disease control and prevention, we are optimizing the management measures. We have also put the management and control of COVID-19 into the network, and this is a part of the work progress. Thirdly, we have also working on the functions of the monitoring, and we believe that hospital is the first threshold encountering into the COVID-19. We have set up several different fever clinics and other different disease areas. We have working on the general clinics and in the prevention and control. And we have also do a good job in the prevention and control for the medics. For the designated severe hospitals, we have selected one designated hospital in every single county and in every single city. And we have also set up one monitoring site for asymptomatic patients. And we believe that this is also a very important center for us to gather the information for the discharged patient and also collect the information for the archive for them. Fourthly, we are also working on the prevention and control mechanism. So while we are working on that, we have opened up the shopping market, supermarkets, restaurant, among other different working areas. We have gradually opened up all the public entertainment areas. The city of Wuhan, according to the progressions of the disease, after we have stabilized all the progress, we have opened up 10 different public areas, including the cinemas and entertainment places. And we are going to continue to work hard and monitoring all the care homes for the elderly people. And we are trying to make sure that until everybody's health is guaranteed, we are not going to open it to the public. And we have also built a mechanism in the day-to-day operations and reporting mechanisms for the children's health. For those who are coming to Wuhan, who has a 40-day history of imported possibilities, we have dealt with them according to a leveled out mechanism. All the other different patients, they are going through a 40-day quarantine area. Fifthly, we are monitoring the progressions of the economy, and we are also building up a monitoring and alarming system for COVID-19. We have also emphasized the reporting system for COVID-19. For the CDC and also the police, public security bureaus, they are going to respond the potential asymptomatic cases within 24 hours. And we believe that the early reportings, early alarms is going to help us a lot in the later detections of the COVID-19. Early detections, early treatment, early reporting is definitely several different chains that we are going to value on. Sixthly, we are also trying to working hard in the monitoring and testings, especially on the asymptomatic patient. We are also enlarging the coverage of the nucleic acid testing. In Wuhan, we have also enlarged our nucleic acid testing coverage. We are also working on the tracings of the asymptomatic patient. Other different cities, including Xiaogang, Huanggang, Huzhou, they have started their nucleic acid testings in the students. And we have also started the nucleic acid CT scannings and serological testing to all the students. And each of the students is going to have their documents and information being built up in our archive. All of these measures required us to adopt a precise targeting mechanism, and we are going to focusing on the requirement of precision and trying to figure out all of the key areas. That is how we are going to make sure there is no relapse of the disease, and all of our result is achieved and is not going to be vanished. That is the end of my report. Thank you. Now the floor is open to questions. Please identify yourself before the questions.
新华社记者提问。请问湖北省将采取哪些措施？
With Xinhua News Agency, what kind of measures will the Hubei Provincial government adopted to make sure that the regular prevention control mechanism is effective in Hubei Province? Thank you very much of your question. To make this mechanism effective is also a requirement of General Secretary Xi Jinping's in the CPC Central Meeting in the 4th of May. To translate all of this requirement into the reality, the CPC Central Committee has also focusing on the standardized measures, and I think General Secretary Mr. Chen Liang has given you a report about our day-to-day measures to guarantee that this is effective measures. Going forward, we are going to focusing on the 3 different fronts. First, we are going to make sure that everybody is sure of their responsibilities. The normalizations of prevention control needs the participations from all walks of life. By making sure that everybody understand their responsibilities, we are making sure that different governmental institutions, different governmental staffs, and among different private companies is sure of their responsibilities. The responsibilities of the CPC Central Committee is about the general management, and we have also give a timely situation-based prevention control measures. And we should also focus on the different industries. We believe that if we cannot control a single private company, it might mess up the whole industry. And we think that the responsibilities for our companies and for our industry is the responsibilities across our whole society. We should also build a good mechanism in the prevention control. And we should also guarantee the environmental sterilization. And for the individuals and household prevention and control responsibilities, it is the responsibility for every household. Everybody should be obeying our rules, and we should keep a close eye on our day-to-day healthy measures, and we should also actively participating in the disease prevention and control. Through our joint mechanism, we believe that in the long-term operations, we are going to work hard, and we should also keeping an alarming eyes of the result of the COVID-19, and we should make sure the result that we have achieved is not going to be wasted. Secondly, since the outbreak of the COVID-19, we are working hard in the community virus-free, the resumptions of work and resumptions of the schools. With all of these guidelines coming into effect, we believe that this is actually guiding the general public to have a clear understanding of the working resumption progress. By generalizing the 33 different guidelines in the 4 different fronts, we are working on the public health and the prevention control in the key populations, key institutions, and the key private companies. And in general speaking, we are going to make sure that everybody understands how do they wear social masks, how do they wash their hands, how do they keep a regular ventilation. The major requirement is to give a guideline to the elderly populations, delivery persons, salespersons, and all these public transportation participants to understand how do they do the prevention and control for themselves in the public areas, especially in the public transportation matters, in the supermarkets, shopping malls, hotels, among other different public areas. We should be clarified what kind of measures should be taken. For the key institutions, we should also understand how will school construction sites understand their requirements of the prevention and control requirements. I believe the guideline is covering every aspect of our lives, and I hope everybody should be clear of their responsibilities. Thirdly, we are also going to continue the disease testing and control. For the disease prevention and control, we are going to adopt timely measures in the 34 different outlines and items in the guideline. Early detections of the problems and early treatment of the problems is definitely going to help us in the future. Especially, we are also going to figure out those who suffered from nepotism, and also we are welcoming the media and all walks of life to monitor our day-to-day operations, and please give us your valuable suggestions. Thank you very much.
你好，中国日报记者提问：小区防控是防范新冠肺炎的第一道防线，请问常态
With
化
China
防控下
Daily,
小区防
the
控
community level prevention and control is the front line of the COVID-19. With the normalizations of the day-to-day operation of prevention and control, what kind of measures are we going to take? So thank you very much for your question. Communities and districts are very important, and they are actually at the front line of the prevention and control. Since we have normalized the prevention and control of the disease, we are working on the grassroots level, especially in the communities and districts, and this is our front line of the prevention and control. So compared with the emergency period, the current stage emphasizes on the standardizations of the community doctors, and we are also provided with a precise management for the communities, and we have made two adjustments. First, we are adjusting the community level medics, and in the emergency phase, there are many governmental institutional workers who are working at the community. This has greatly eased the pressure in the community level. With the work resumptions and the reopening of the economies, I believe all the CPC party members is going to go back to their normal working position. Under this situation, we are going to readjust the measures, and we are also going to promote the result that we have achieved. For the CPC members, medical workers, and community managers, they should adopt a self-volunteering manners in the promotion and control, and they should also stick on the general guidelines, building up a co-constructed, co-sharing, and co-management scenarios in the community. Secondly, we should also working on the precise management in the community level. In the city of Wuhan, we are continue to enhance the result that we have achieved in the communities, and we should also emphasize it in the elderly on the old communities and districts, the dormitories for the company workers, among other different areas. And we should stick on that everybody should get their health code accessed, medical mask addressed, among other different measures. Outside of Wuhan, all of the lower risk regions should optimize their day-to-day operations. and they should also focusing on the exclusions of the general populations. Thirdly, we should also working on the network management. That is how we are going to exclude the possible cases in the COVID-19 by including them into the day-to-day operations. We are also going to gather all the information from the community workers, and we are also going to focusing on the information screenings. By building up a sharing mechanism in the community, this is going to lower down the risk in the highly risk regions, and we should also working on the monitoring of the asymptomatic patients and poor populations, migrant workers, among other different groups of the society. By gathering all of their informations, it is going to be a very effective and orderly measures. Fourthly, we are also working on the government organizations by connecting the normalizations of the measures, and we should also working on the localized measures. Once there is any detections of the COVID-19 in the community level, we have built up a virus-free community. We have also been focusing on the virus-free communities. For these virus-free communities, we are trying our best to tackling with all the possibilities in these virus-free communities. By doing a continuous efforts in the communities, we are also trying to provide the community residents a healthy guidance for all of those communities who are posed to the COVID-19 outbreak. We believe a reasonable management is definitely going to help us to eradicate the COVID-19, and for the different regions, we should working on the normalizing of the digital life in the community.
中新社记者提问：随着我省医疗秩序的逐步恢复，现在到医院。
With China News Agency,
但有的群众担心可能遇到新冠患者。
there are more people coming to the hospital
医疗机构是如何保证？
currently, but some of the people are worried that they might encounter the COVID-19 patient and they might get infected. How do we guarantee the safely operation in the hospital and medical institutions? Thank you very much for your question. Life and healthy is the core interest of the general public, and it is the very important concern of the CPC Central Committee and also the state government and also General Secretary Xi Jinping. To guarantee a safe hospital environment, we are trying to safeguard the front line of the COVID-19 outbreak, which is the hospital and also the medical institutions. For the medical environment, we are trying to pose no risks. First, we are working on we have made the fever clinics serving as an alarming system for all these level 2 and above hospitals. According to the general standards, they have set up the pre-examination and pre-testing requirements. 24/7, they are going to in the alarm 1, and we have also adopted a pre-examining requirements for all the patients who are coming to the hospitals. We test their body temperatures, view their health card, and we have also adopted measures that the first responder, the first medical workers who are taking them in, should be responsible for the common medical result. And we have also standardized the PCR testing for COVID-19. According to the general requirement, we have reported and quarantined the COVID-19 patient. And we are making sure that all the fever clinics and patients is not going to get infected in the hospitals. Secondly, we are also working on a closed-looped fever clinic. We have also built up a common clinics and also the common emergency room. For the fever clinics, the doctors is providing a professional scanning and testing for all the patients. And we are providing a whole processing closed-loop medical checking procedures, making sure that all the patients who are get into the fever clinic is going to get a quickly testing. For all of the patients who entered into the fever clinic, all of them is going through the PCR, antibody, serology, and CT scanning. Excluding all of these people, for all of the other patients, they are going to be delivered at the designated site according to the requirements. And in the community level, they are also going to adopt a self-quarantine measures. And the result is demonstrated in the big data public platform. Thirdly, we are also working on the inter-hospital infections, working on the emergencies, outpatient, inpatient, and operation theaters. For all the different institutions, we should sterilizing our diagnosis and treatment environment. We should also adopt a better ventilation requirement. We should also implement the requirement in the 3 different regions. For all the medical workers, they should adopt the standardized measures to select and put on the medical masks and also the medical gloves. For the taking of the patient, they should adopt a double-track system to treat and prevent the patient in the different areas. In the different medical wards, there is no nurserings and there is no visit mechanism open to the public. If the family member want to meet the patient, they can view their patient through radios. I think that in the future we are going to continue the zero infection in the hospital, and we are also going to exclude all the risks in the hospital to make sure that the hospital is working in a very sterilized manner. After the outbreak of the COVID-19, we have arranged medical workers to get PCR testings before they get back into their positions. After all the medical workers, doctors, and nurses get back into the positions, they have also undergo a serology testing, and we have conducted 2 specialized in-hospital testing. For all of these potential departments and also the personalized staffs, especially for the imported cases and also the gathered places. And we are working on the basic measures to make sure that the problems and the risks that we have detected is going to be digested. And that is how we are going to make sure that the day-to-day work is translated and working in the precise measures. And this is how we are going to guarantee zero risks in the hospital. Going forward, we are going to emphasize our responsibilities and build up the great work for COVID-19 in the hospital. And this is going to make everybody feel safe and healthy in the hospital. With Yangtze River Cloud, asymptomatic patient is where our concern lies. How will the Hubei Province better manage the asymptomatic patients? Thank you very much for your question. To better manage the asymptomatic patients, we have built up a system for reporting, management, and treatment. Based on the national requirement, we have conducted the screenings, testings, quarantines, reportings, and treatings for these asymptomatic patients. First, we are working hard on the nucleic acid testing, and we are trying to take in every testing that we could. For city of Wuhan, they are trying to make sure that all the people departed Wuhan, public health workers, and workers in the other different public institutions is going to get a PCR testing. For all of these poor populations and also the migrant workers who might get in touch with the whole population, all of these people is going to get tested. We are also going to make sure the elderly and communities and also the dormitories in the private company is being fully covered. By combining the prevention and control mechanism and work, we are also conducting a PCR testing and a larger coverage. Wuhan City, outside Wuhan, we are also doing a very good PCR testings in the teachers and also school staffs. According to the situations in different provinces, they are going to decide whether they should do the testings based on the cities and counties situation. In Hubei, in Huanggang and Xiaogan, for all of these students who are resuming their schools, they should go through the PCR testing. Starting from the January and February, we have announced the testing results, and the PCR testing laboratories is increased to 261 institutions. And we are trying to guarantee that a bunch of the third-party institutions can provide qualified PCR testing results. The daily capacities of the PCR testing is increasing. Recently, we have conducted and opened up a series of laboratories for the PCR testing. And we believe that 99% of the laboratories is qualified. Through our monitoring, through a general bidding mechanism, we are lowering down the fees and expenditures of the PCR testings and antibody testing. Currently, 130 RMB and 40 RMB respectively. During the emergency period of the COVID-19, the PCR testing and antibody testing is a part of the public medical insurance. Thirdly, we should also working on the diagnosis requirement. For the different working institutions and public health institutions, there should be a direct reporting alarming mechanism within 2 hours. So the nucleic acid testing should also go with the CT scannings and also the PCR testings and the serology testings. The result of the imaging, CT imagings and also the laboratory result should be a part of the report. For the asymptomatic patient who are showing the COVID-19 symptoms during their quarantining areas, we should give them a timely transfer to the designated hospital. Fourthly, we should also working on the asymptomatic patients. The community should organize a very good epidemiological traceability research and organizing the different governmental institutions, including the public security bureaus, transportation bureaus, to analyzing their transportation track to make sure that every risk is eliminated in the progressions of the COVID-19. The newly reported COVID-19 cases is going to finish their epidemiological research within 24 hours, and this report should be gathered in the CDC Hubei Province after a research and judgment of the cases in the CDC Hubei, the experts should participate in that. Fifthly, we are also working on the sterilizations and of the asymptomatic patient among their close contacts. For those asymptomatic patients, we should put them in a collective medical quarantine. If their PCR result is positive for twice, we can discharge them from the quarantining area, and their result should be a part of the community health code as a part of the general key persons in the public management mechanism. Going forward, we are going to normalize the procedures in the asymptomatic patient and making a closed loop for the asymptomatic patient, trying our best to make sure the whole people, the general public across the country should be assured and feel safe and healthy about our results. From People's Daily, you talk about the management of the asymptomatic patient. So after we emphasizing and strengthened the PCR testings, what is the result? Are we analyzing the result of the PCR testings for the asymptomatic patient? Do they still shed the virus to other people? Are they contagious? Thank you very much for your question. I'm really honored to participate in this news conference to brief you the latest understandings of the COVID-19. The enlargement of the PCR testing is definitely going to help us and identify those personnel and block the spreading of the COVID-19. This is a very important part in our day-to-day operations, and it's also a very important part in the work resumptions and also the school resumptions. And the comprehensive evaluations of the risk of the COVID-19, the enlargement of the coverage of the COVID-19 is definitely going to make sure the safety and health of the general public and promoted the whole resumptions of the work and life. To my knowledge, Hubei Province has invested a lot in the PCR testing. For the early detections of the infectious sources, the province of the Hubei, by the 17th of May 2020, the total Hubei province has provided the PCR testing for 6.39 million people. And the 7th of April, the total PCR testing in Hubei is actually covered 27.49 million people. There is the ratio between the asymptomatic patient and the general population is around 8.5%. And in Wuhan, there are 221 asymptomatic patients. Starting from the 8th of April, after we have opened Wuhan and opened Hubei, the total populations underwent PCR testing is around 470 million people. The total testing result in the city of Wuhan is around 26.49 population. The testing ratio is around 0.027%. By the 17th of May 2020, the total testing result in the Hubei province is around 10.01 million people, and Wuhan city is accounted for 72%. And for the testing ratios of the asymptomatic patient, it is around 0.0464% of the whole populations. With the enlargement of the covered population, the testing ratios is declining. We believe the result is very promising. Generally speaking, there are two scenarios for the asymptomatic patients. Some of them are negatively infected. Another part of the asymptomatic patient is in the latency, and for the majorities of the asymptomatic patient, they belong to the first categories. They have a very low virus load. According to CDC Wuhan, starting from the 8th April 2020 to the 15th of May 2020, there are 650 of the asymptomatic patients in Wuhan, and that was the gathered outbreak in the Xiamen district, and there are 2,500 close contacts, among which 2 of them is transferring into asymptomatic patients. There is no asymptomatic patient turned into the confirmed cases. According to their serological results, we have come up with the conclusion that 547 of them is in the recovery phase of these asymptomatic patients, among which 674 of them is the newly infected asymptomatic patients. 3 of them we cannot trace them back. And in the CDC Wuhan, we have also sampled the asymptomatic patients, droplet samples and nasopharynx samples to the CDC, and none of these samples can grow the virus. That is to say, for all of these asymptomatic patients, they have a very lower virus load. So with the ever enlarging of the general screening populations and ever smaller populations for the asymptomatic patient, we believe the work that we have done so far is very effective. With Hubei Daily, so there are the discharged patient in Hubei Province is actually the largest population across the whole country. By the 27th of the May, how do you view the latest progress? Thank you very much for your question. Hubei Province has the largest population of the discharged patients across the whole nation. By the end of yesterday, the total discharged patient is around 68,000 people. To better translate General Secretary Xi Jinping's requirement into the reality, we are working at these 3 forefronts. In the communities, we have built up coordinated mechanisms. For the hospitals, communities, among other different institutions, they should make sure the patient is recovered in a timely manner. Across the whole province, there are 146 designated hospitals to make sure the recovered patient is cared in a timely manner. And we are also working together with over 20,000 medical institutions to provide generalized and concentrated areas for the recoveries of the patient. And we have also provided signing procedures for the patient and the whole populations. And we sign up every single patient that we could after we have discharged the quarantine areas. The household GP system is going to appoint them and collect their follow-up information. Within 4 weeks, for every single day, we are monitoring their day-to-day operation. For every single month, we provided a face-to-face medical treatment and giving them all kinds of the mental support. We provided mental support and also the physical support while we are working on the underlying disease of the patient. some of the patient has encountered the psychological problems. After encountering the psychological problems, we have organized the Red Cross and the province to work together with Wuhan City's rehabilitation areas and the streets, among other different areas, by providing a very good mental support system. We provided the psychological treatment and psychological evaluations according to the patient's demand. We have also built up connective systems between the patient and the medical institutions. We have selected several different professional psychiatrists to be a part of the community volunteering system to provide online and offline psychiatry and mental support. By working together with the civil service office, we provided professional trainings at different levels. Thirdly, by combining an online and offline treatment, we are working on the efficacies of the traditional Chinese medicines, and we have came up with a specialized TCM treatment plans. And we have came up with a very good TCM recovery and rehabilitation campaigns, provided the recovery and rehabilitations to the patient. By using the internet, we have optimized the service that we provided through the online hospitals, GP mechanisms. We are providing the day-to-day operations, day-to-day medical service to the patient across the whole country. We have built up a COVID-19 prevention and control mechanism for the patient. In addition, Wuhan City has also clarified that during the COVID-19 outbreak, for those people who are recovered in the quarantine area in Wuhan, their medical expenditures is going to be covered by the government. This has eased the burden for the patients. For the different levels of the medical workers, they are also working on the day-to-day operation of the patient, and we have forbidden any return of the patient and refusal of the patient. Here, in these opportunities, I'm calling across the whole society, do not discriminate of the COVID-19 patient. Currently, according to the scientific result, for the people recovered from COVID-19, they are safe to be back to be a part of our society. No matter they are your friends, colleagues, neighbors, we should accept them and embrace them in their workplace, in their day-to-day life. Let's work hard to help them to be a part of our society. Thank you. With that, we conclude today's press conference.